Welcome back to Breakaway, everyone. I am now here with Dr. Paul Gaskins of Mullen & Gaskins Dentistry, and they are located at 901 North Winstead Avenue on the first floor in Suite 120, and they're kind of tucked back in the corner of Rocky Mount Medical Park, a best-kept secret. Dr. Gaskins, we're so happy you could be here with us today.
Thank you, Jen. My pleasure.
So, Dr. Gaskins, to start, tell our viewers a little bit about you and your family and how you ended up here in Rocky Mount.
Well, I'm originally from Pitt County, from near Greenville, Ayden to be exact. The youngest of 6 children. Currently I have a wife, Kim, and 2 daughters, Samantha and Miranda. Originally was in Wake County working in Raleigh when Dr. Mullen gave me a call and asked me to come to Rocky Mount. That was 6 years ago. It's hard to believe that many years have gone by, but time flies. And we've been here 6 years, and we've really become a part of the community now, and we really enjoy being here.
And you guys together have really established a very well-respected dentistry and practice here.
Yes, and you know, Dr. Mullen established a pretty strong legacy here, and I've been fortunate enough to follow in it, his footsteps, and it's been a good 6 years.
And you actually, Dr. Gaskins, received the award for the best dentist in Rocky Mount by the Rocky Mount Telegram, and that is actually an award that is strictly based on the people in the community putting forth their vote. That must be quite an honor for you.
It was both an honor and a surprise. I really didn't expect it, but I certainly try to do my best every day and treat people like I want to be treated. Sure. And I think that goes a long way, and people appreciate that. And so I was very humbled by the award.
Well, congratulations. And with regards to your practice here, I know you offer a wide array of treatment and services. Tell us a little bit about those.
We do. We like to call ourselves a family dental office, and that's not just a name. We really mean that. We have patients ranging from 4 to 94 and beyond. We offer a wide range of dental services, including preventative services such as cleanings and sealants. We also obviously do fillings, including tooth-colored fillings. We also do a lot of crown and bridge work, as well as dental implant reconstruction and restoration. We also do some denture and extractions, and we do cosmetic cases, including teeth whitening and veneers.
But you mentioned cosmetic dentistry, and I think a lot of times people get confused. What is the difference between general dentistry and cosmetic dentistry?
That is a confusing issue. In my mind, everything that we do has a cosmetic component to it. It doesn't matter if it's a front tooth or a back tooth. You ought to have the patient's cosmetic desires in mind when you treat them. Having said that, there are some cases where you're dealing more with what's in view than you are anything else. And that does require special handling and special training in order to do it properly, and also utilization of the proper kind of dental lab that's going to make those restorations for you. And that requires extra education and constant training, which we have attained here.
And do you have a preference as far as certain areas you prefer to treat?
I do. I think 2 things jump out at me, and they're probably more broad-based in my answer than specific. But first and foremost, I really enjoy helping a fearful patient overcome their fear of dentistry. I enjoy having a patient who has really neglected their dental health for years because of fear, come in and work with them to get over that fear and make dentistry a part of their overall health care. Because it really is. It's something that's very much neglected, but I enjoy helping patients overcome that fear. And secondarily, I think I enjoy working with a patient on cases that really improve their smile, because that really does impact their self-esteem, and you get so much reward from that.
And that's got to be a wonderful feeling.
Absolutely.
And you mentioned the fear factor. I would think that perhaps that's one of the contributing factors as to why people don't come in regularly and have regular dental work. Perhaps money also? Fear
is definitely a part of it, there's no question, but I think finances plays a part as well. With regard to fear, there's no question that people associate going to the dentist with pain. And while you can't completely remove that from the equation, you can push it down to a bare minimum by utilizing a gentle, caring approach in the way that you're treating the patient. And we try to do that here as best we can. Also, too, with regard to finances, we do work with our patients and try to be flexible. We have a number of ways to help people pay for their dental care.
And several times you have mentioned the importance of providing comfort for the patients. And I think comfort is about the treatment, but it's also about when the patient enters a door, the environment and the staff and all of that. And your staff has been with you for quite some time, correct?
That's right, and actually some of them actually predate me. They were here when Dr. Mullen was here by himself. Jane and Sheila work our front desk, and they've been here longer than I have. Deborah and Kelly and Allery are my dental assistants. They've been here with me several years, and Melissa and Stacy, our dental hygienists, have been here many years as well.
And we were talking earlier, and you mentioned that you really focus on families. You treat the entire family as opposed to the individual, correct?
That's right. We, as I said before, we have patients as young as 4 on up to in their 90s and beyond here.
Because I think it's really important when you're choosing a dentist to make the right decision, because that is often a relationship that you and your family are entering into for the span of a lifetime.
Absolutely.
Correct?
It's very important, no question.
Well, Dr. Gaskins, thank you so much for being with us today. We really appreciate it.
Thank you, Jen. It's been my pleasure.
And you stay tuned. We'll be right back.